Assalamualaikum warahmatullahi wabarakatuh. My name is Deni Aziz, and now I'm going to explain my presentation. And I pick influenza for my material. So, my material is about influenza. Influenza, commonly called the flu, is an infectious disease caused by influenza viruses. Symptoms range from mild to severe and often include fever, runny nose, sore throat, muscle pain, headache, causing, and fatigue. The symptoms typically begin 1 until 4 days after exposure to the virus and last for about 2 until 8 days. Diarrhea and vomiting can occur, particularly in children. Influenza may progress to pneumonia, which can be caused by the primary viral infection or by a secondary bacterial infection. Okay. And then is about the symptom of influenza. The time between exposure to the virus and development of symptoms, called the incubation period, is 1 until 4 days, most commonly 1 until 2 days. Many infection incubate many infection, however, are asymptomatic. The onset of symptom is sudden, and initial symptoms are predominantly non-specific, including fever, chills, headache, muscle pain or itching, a feeling of discomfort, loss of appetite, lack of energy or fatigue, and confusion. The symptoms are usually accompanied by respiratory symptoms such as a dry cough, sore and dry throat, hoarse voice, and a stuffy or runny nose. Okay, and the next material is about if you get influenza, there are several points you can do it, including the first one is stay home and get plenty of rest. Okay. The second one is drink plenty of food. Uh, and the next one is treat age and fever. And the next is take care of your couch. Sit in a steamy bedroom. Run the humidifier. Try AL-Aziz. The next one is get salty. And the important point is ask for an antiviral. You take these drugs as soon as symptoms start. They can lessen and shorten the flu. Call your doctor if you have signs of the flu and are at a higher risk for complication. Okay, and the next material is uh, what you have doing when you are get a flu. Okay, when you get a flu, you have to go to doctors and specialists. Most healthy individuals don't require a doctor's care to prevent, diagnose, or treat the flu. Flu vaccines are now readily available at local pharmacies and grocery stores at very affordable price. Treatment for the flu is often simple bed rest, fluids, and over-the-counter pain relievers for symptoms. You should also get care if your symptoms suddenly improve and return with a worsened cough and fever. There are a number of doctors who can help with flu prevention, diagnosis, and treatment. Their role in combating the flu and its related complications should not be minimized. So, if you've had the flu once, what can you do to keep from getting the flu again? The tried and true advice still applies. Okay, you can do an annual flu shot. The best way uh, to protect yourself and others is by getting the flu vaccine every year. It decreases the risk of acquiring the infection, and it can decrease the severity if you do acquire it. The second one is you can you can stay home when you're sick and encourage others to do the same. Okay, and the, and the next point is wash your hand all the time, but especially during flu season. Good hand hygiene is important. Wash your hand frequently with soap and water, or use an alcohol-based hand sanitizer. Avoid touching your hand to your eyes and mouth. And the next one is drink plenty of fluids and see if you are a candidate for an antiviral medication. One of the important things for treatment and overall wellness is hydration. When hydration is recommended, water is always ideal. There can be a lot of fluid loss with the fever caused by the flu. Medication like ibuprofen and acetaminophen can provide symptoms relief. If you can start the antiviral Tamiflu in the first 24 to 48 hours of symptom onset, it can decrease the symptom duration and viral shedding by about a day. It also likely can decrease the risk of severe complication. Okay, that's all for me. Thank you very much. And wassalamualaikum warahmatullahi wabarakatuh.